Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Because you're right, it's probably going to be challenging, but I thought it might be interesting for our viewers.
Going on while we're waiting.
Do you guys have something black in front of you too?
Yes.
Oh, okay. All right. Yeah, this is an article that talks about the importance of just moving. Exercise as a component of preventive health that we've talked about in all of our programs, but some people can move around more than others. You know, the minimum requirement is 30 minutes a day, 5 days a week. But for some people, that's too much. And this article points out that even walking or moving around for less than the amount of time that is recommended is helpful. As they say here, this is the minimum of activity that's requested. I also think there's the same amount of time that you need to spend in spend meditating. Uh, 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 I think that you spend equal time meditating as you do exercising. I think is very helpful. But anyway, there are those who have difficulty doing that. So for those people, uh, moving around and exercising, we talked about the exercise in which uh, you really just exercise your muscles and how that is helpful in lowering the blood pressure as well.
I'm going to need to stop the share briefly. Hold on.
There's so many different medical conditions that can keep people from being able to actually exercise 30 minutes a day, 5 days a week. And we've been blessed, many of us are blessed, so we can do those things. But there are people who have other conditions that they can't do that. And so this is an article that lets them know that moving around is very helpful, even if that's all you can do. If you can't walk because of whatever reason, there's still things that you can do to increase the circulation that will help you. And it's important for longevity. We've talked about the various types of exercise. From perhaps the best is swimming and weightlifting and other things, but everybody isn't as capable of doing those things as others because of varying degrees of arthritis and other conditions. So trying to find a way to keep your body parts moving is good for your health. Any comments about this? Any tips that you have to offer for those who can't do those 150 minutes a week exercises? No comments? Okay, I guess we'll go to the next one. I think we have about 20 today. So this is an interesting article about how eggs affect your health and talk about the fact that eggs are a good food. There have been many talks about the cholesterol and component of eggs, but even that is thought to be healthy cholesterol. But the bottom line is that eggs are a very good nutrient, and are desirable. Any thoughts to the contrary about the role of eggs in our health?
Dr. Callender, good morning, everybody. This is Sylvia. I fixed my husband this week an avocado toast, which had a soft fried egg on top of it. And he was like, "Don't put the yolk in there, just give it to me all white." And I told him, I said, "I think all those myths have been debunked." He said, "I don't know, but just give it to me all white." So I tried to tell him about the proteins and eggs. He just said, "No, just give me all the white and make my avocado toast with just the white." But I'll have to show him this article.
Yeah, avocado is a great fruit. But yeah, you're right. There's a lot of uh, misconceptions about eggs.
But Dr. Callender, that was because early on, didn't they tell us don't eat as many eggs, and that's where that all started years ago.
Yeah, because it was about the cholesterol and the fear that the cholesterol in the egg yolk would
In the yolk.
would cause problems. But they later recognized that it was healthy cholesterol, not unhealthy cholesterol.
Well, my comment is look at that last paragraph when it talks about what you fry the eggs in, recommending using high quality fats like butter from grass fed, pasture raised cows and organic grass fed ghee. Okay, so not just the butter, but our whole farming economy in America is based on, okay, most people, you go to the store, you don't buy organic, you buy uh, just regular stuff, and our regular stuff is we have a corn based economy. A lot of that has to do with politics, keep the Iowa farmers happy. That's corn country because they're the first in the country primary for presidential politics. But for chickens, corn is not their natural diet. It makes them sick. In order to get them to market, you've got to get them, feed them antibiotics. Of course, you're feeding them with corn. That corn has been raised on pesticides. So you got a lot of junk, not just in the chickens, but anytime you're eating anything that's other than organic meats in America, they're full of antibiotics, pesticides, growth hormones, just to get them as fat as possible to get them into market. So you're eating a lot of toxic material in your eggs, in your chicken, in your beef, in your pork, unless it's organic. So, I would, as devout a vegan as I am, when I go out of the country, if I'm hungry, I don't mind eating a few meat products every now and then. But in this country, I wouldn't dare. Couldn't risk it.
Any other comments?
I would like to say that's good for people that have money, but organic costs more than regular food. So you really need to be rich to do organic.
Yes, it does, unless you're a vegan, because what you pay for your meats, if you subtract your meat budget from your diet, your grocery bill goes down, even though you eat all your plants, all your fruits and vegetables organic. You stop eating meat, you reduce your grocery budget by about 30%.
Any other comments? Okay, let's go to the next one. This is an article talking about the weight gain in children and adults is linked to 100% fruit juices. And it talks about some of the aspects of how fruit juices gives you too much sugar, and how this can lead to insulin resistance and other problems. I'm not sure that how many of our children have so many fruit juices, but this certainly is something that can happen. How about our children? Your children, your grandchildren, are they're getting a lot of fruit juices? That's not been my experience with my children, but how about yours?
Hey, Dr. Callender, this is Sylvia again. Not children, my husband. When he gets fruit juice with the breakfast, he gets a whole full cup. I try to pour him maybe like a fourth of a cup, and he goes back and gets more. So I try to tell him about the sugar content that's in that juice. So I'm trying to work this year on lowering sugar intake. And so I'm trying to do what Miss Tatum does all the time, have no sugar drinks.
Yeah, of course, the problem with fruit juices is that it's the fruit missing the fiber. Fiber slows down the absorption of the sugar into the bloodstream. When you get a sugar hit without the fiber from fruit juice, when it hits the liver converts it to fat, that's the top paragraph we're looking at, so it can be stored easily and kept out of the blood. And so that fat contributes to the weight gain.
I would like to say something about the no sugar. No sugar is worse than I just discovered than sugar. And unless you're constipated, then do the no sugar and that'll help you tremendously. But regular sugar, and why don't you, if you have orange juice, just squeeze the oranges, which takes more time and you get less, but at least you get the pulp in it. And or etc. Juices, we were raised, I think most of us were raised to have juice in the morning. But instead of canned juices or etc., do that. Try to stay away from no sugar products unless you're diabetic.
Any other comments about this article? Okay, let's go to the next one. This is an article about Banting, who was the youngest person to win the Nobel Prize, because he and his medical student discovered insulin. And insulin, of course, is the treatment of choice for people who are born without islet cells and without being able to produce insulin. And it talks about how he and the medical student discovered insulin, and how this occurred. And it's interesting how that this doctor and his medical student did a lot of research to try to figure out how to treat diabetes, and lo and behold, they discovered insulin, which now, of course, we use across the globe. But what I thought was so interesting is that even the work of those two was associated with all kinds of problems, even sharing the Nobel Prize money with his medical student, which was not thought to be appropriate at the time. But it's amazing how something like insulin, which is now used everywhere in the world, occurred because of diligence and research. And then a man who at 32 became the youngest Nobel laureate. He died in a plane crash in 1941, but I thought it was an interesting story about how insulin was actually discovered. And all diabetics at that time, if you had diabetes, you pretty much died because there was no treatment for it, for type 1 diabetes anyway. This is an alarm that the Red Cross is sending out because most people aren't aware of how life saving life is related to uh, blood donors. Uh, Blood saves so many lives every day, and the unavailability of blood is extremely damaging. Almost all surgery is associated with blood and the need for blood. And uh, blood donors are the life of America in many ways. And we fortunately have John Buchanan, who is a role model for blood donation. But people like him are very unusual. And sometimes we take for granted the availability of blood transfusions, but it's not something that we should take for granted. It's life-saving transplant of sorts that we shouldn't take for granted, and we need more people to help. Buchanan, you have any comments about that?
Well, yeah, it takes about maybe 40 minutes once you check in, and they take you through the triage, not the triage, but you have to answer a bunch of questions about your lifestyle and whatever, and to make sure you're not on certain medications that could prevent you from donating. And there, at least, I've been going to the NIH for almost 30 years, and they're one of the outstanding phlebotomy departments, transfusion medicine in the whole world. I think they're super professional and very, 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 very careful. And they also do where you take your platelets. You can do that. They recycle your blood through a machine, take out the platelets and put it back in you. And you can watch a movie while you're having that done. And you get to choose the movie that you want to see. So it's it's not as bad. I thought it was going to be horrible at first. I was afraid of needles, and the donation needle is a lot bigger than your regular needle, but you get used to it. And I just did my 106th donation last month, and it's a really good feeling to know that you're helping other people.
So you missed out on the Super Bowl raffle, huh?
Yeah. Well, this is the Red Cross, and they've been doing it also. But at the NIH, I mean, we get coffee mugs every now and then, or shopping bag, T-shirt. They really look out for us.
Mr. Tatum, you had something to say?
Yeah. Has anybody heard about the lottery that's being offered for people who donate blood? They put their names in a lottery, and they can win a whole lot of money if they're chosen. I don't know if anybody's heard of that, but I did.
Anybody heard? Oh, Sylvia, you had something to say?
Yeah, in my younger years, I used to get blood at least once a month, like John. But as I got older, seems like every time I try to go to give blood, I'm turned down once they do the prick of the fingers. And what they tell me is, well, you need to probably maybe just eat a steak or something before you come to get whatever I need to get up. But I don't normally eat steak. So is there anything that I could do that will pump up because when I went to my regular doctor and I told her that this is what was happening, she just indicated that the Red Cross has a little higher standard when they're, when they're requesting blood, but everything looked good in my blood. But is there anything I could take or do? Should I take iron pills before I go? Because I want to get blood, but every time I go, I'm turned down.
Well, I have a response to that. I'm glad you brought that up because I had been denied donating at least 4 times. And it's because I had low hemoglobin. And, they pricked the finger beforehand and test your iron level. And they found out that I was kind of anemic. So they actually put me on a program where they were supplying ferrous sulfate, I think is the pill. It's an iron pill, like you were talking about. And I did that for a couple of years, and uh, it was unusual for a man to be as anemic as I was. After they stopped supporting that, I started taking Vitron C, and that I haven't had an issue after that. So it depends on who you are. It depends on your metabolism. But yeah, I've had success with Vitron C. And also I used to donate every 2 months, and they said, well, you should probably donate less than that, every 3 months maybe. But I'm back every 2 months with Vitron C, and it's okay. My hemoglobin is normal.
Vitron C. I don't know where would I get that, or is that something over
That's
the
a
counter?
multivitamin. Yeah.
Yeah,
It's available,
I do
available
take
at
multiple.
most drugstores,
Over the counter.
Botron,
over the counter.
Botron C. Okay, Botron C. I'll look for it. Thank you.
I get
Vitron.
mine at the Giant.
The Giant. Okay.
Yeah, Vitron C.
Vitron C. Okay, thank you. I'll try that because I'm going to try to give blood um, before the end of the month. But I will probably try to take. I do take multiple vitamins every day, so that's why I was
But
wondering.
iron is the key ingredient that he mentioned.
Botron. Okay.
Iron.
All right. Thank you.
Any other comment? If not, we'll move to the next one. This is an interesting article about, we've talked about hearing aids many times. But this article says that they help, but they help boost longevity, but only if used regularly. So if you have a hearing problem, but you just put it on episodically, it's not as beneficial. It's also not as beneficial in terms of decreasing the likelihood of dementia as well. So it's healthy, those old people over 65 who have hearing impairment and who don't want to wear hearing aids. So it's food for thought. When you first start wearing them, you are very sensitive, but after a while, you get used to it.
Well, my mom is 92 years old and she has a hearing aid. And she wears
Yes.
it every day. She needs it. She needs it.
Yeah, it's isn't it interesting that only 12% of people who have hearing problems actually wear hearing aids.
Wow.
So pride goeth before destruction.
Yeah, generally hearing tests are free, and people underestimate their hearing loss. Before I got hearing aids, I guess my hearing loss was maybe about 10-20%. Got tested, found out it was 50%.
Mm.
Well, hearing tests are not always free either.
I have a
Well,
hearing aid, a hearing test on my watch. And how does it work? Well, what it does is like you have to have a pair of headsets or earpods or something like that. And when you go into the test, it gives you sounds and they decrease the volume of the sound as you go along. And then you have to indicate your point where you cannot hear anymore. And that's how they do that.
Yeah, I did that that hearing test on my watch and phone, and it matched up pretty well to the hearing tests I got at hearing centers.
And the watch and the phone are not free. It costs a lot of money.
Right. Well,
But
there's a couple of let's see. I went to the test was free at Costco, and I went to a couple of hearing aid stores where the test was free there. Not always free, but I was looking for places where I could get them for free.
Sylvia, you had a question?
Yeah, no, not a question, just a statement. The AARP, on their website, they gave you a telephone number for a free hearing test, and on your phone, you could do the hearing test, and it's similar to what John was saying. They would give you tones, and you would press the number if you heard it, and then they would give you your results. But the AARP website had a free hearing screening test on their website. I took that some time ago, but I'm not sure if they still have it. But I did that by way of my home phone, or now you can do it by way of your cell phone.
You're welcome.
The only
Yeah.
real downside is that you get what you pay for. So if you pay $3,000 to $4,000, $5,000 for a set of hearing aids, they're going to work wonderfully. You're going to be really happy. And then the hearing aids are going to die in about 2 to 3 years. And you're going to be very unhappy because you got to spend that money again.
So what do you do? I mean, you still have to get a hearing aid. Are you just saying every
Right.
2-3 years you're gonna have to
You
pay?
You buy a new pair.
Right.
Okay. Got it.
Why,
Yeah.
why would they go bad?
What's
It's just
that?
they do. I don't know why. It's just like anything else
Well,
after. I don't know. It's not, they all have batteries, but they after a period of time, they wear out.
I tell you
Yeah,
why they did it, so that the manufacturers could make some more money.
Well, maybe. Mine are rechargeable. Some of the degradation that I notice over time is that I can have phone conversations through my hearing aids. And the quality of the phone conversations that I got when they were brand new were spectacular. But they degrade a little bit every day, and I can tell the difference. And so that lets me know that my hearing aids are starting to die. And I've had them for a couple of years now. I probably got 1 year left before I got to replace them. So I got to start saving my money.
Yeah, well, I know that they do that for cell phones, and computers. The batteries are not lifetime. They go bad. And I think it's I really go back to saying it's a manufacturer's scheme to keep you coming back.
Well, it keeps you coming back.
Morning.
Good morning.
Morning.
Any other comments? If not, let's go to the next one. You want to try that now? John, did you want to try that now?
I'm sorry, I was muted. I'm afraid to, Doc. Maybe we can come back later on this. one.
Okay, all right, let's do the next one.
Yeah.
This is an interesting article that I hadn't seen before, that toothbrushing in hospital reduces infections and death. We all brush our teeth every day with floss and all that stuff. And sometimes we don't appreciate how that decreases infections in our bodies. And then when you get sick and you go to the hospital, especially if you're in the intensive care unit, they don't brush your teeth and don't do flossing and all that stuff. And it's apparently that's something that we need to be doing because the most of the tests now identify that as you go down the screen, that the infection rate, hospital acquired infection rate, the mortality rate, all decreased if actually you brush twice a day. And that in general is not done in the hospital, in the ICUs. And that's something that needs to change, because this article identifies that the infection rate is increased when you don't do this. So some of us take for granted that when you're able to do it yourself, you brush your teeth twice a day. But when you go to the hospital and you're in an ICU, that is not something that is always practiced. So it's something to keep in mind, and for hospitals to emphasize that in the ICU that brushing teeth is something that we should be doing.
Dr. Callender, I've never seen any video or any time of anybody in the hospital where they brush anybody's teeth. So is this something that's normal now? I mean,
No, it's something that we should do now. We didn't say normal now. It's something that we should do. And this article is indicating that we haven't been doing it, but we should.
Interesting.
Because as you said, it's not something that is commonly practiced.
Mary Ellen, when you were working for the dentist's office, did you brush the patient's teeth?
The patients usually brush their own teeth.
You're on mute, Mary Ellen. Mary Ellen, you're on mute.
Yeah, okay. We used to teach people how to brush their teeth.
Yeah,
We didn't
right.
brush them.
Right, that's generally the practice. They teach you how to brush your teeth.
In the hospital, they give you, they give you like a little basin, and they give you mouthwash and toothpaste and a brush and soap and lotion.
What about floss?
No, they don't give you floss. But I know when you go in the hospital, they give you that little packet, and it has all those things in it. But yeah, for people that can't brush their teeth themselves, that's the problem.
So true. But now we know that it's the source of hospital-acquired infection as well as other infections. And it's interesting, they have analyzed the aspects of toothbrushing, and they have identified that the only phase of toothbrushing that isn't absolutely essential is the fluid you take to rinse out your mouth. That is the only part of it that's not absolutely essential, but the rest of it, including the flossing, is an important part of it. The physical aspect of it is very important. Brushing and flossing as well.
I'm glad you mentioned that, because when I go to the dentist, they always ask you, do you want fluoride rinse today? And that costs a little bit more.
Well, there's nothing wrong with it. It's just that of the things that you do with when you brush your teeth, that is the one that is most you can do without more than the toothbrushing becomes very critical. The flossing becomes critical. But the mouthwash, it's okay to do it and it's helpful, but you can do without it. But you can't do without the physical aspects of the toothbrushing.
Dr. Callender, good morning, everyone. This is Elizabeth. I am so thankful that when my mother was in rehab, one of the things that my sister and I did was that we cleaned her gum every day, and we use the they have we had to ask for it, okay? In rehab, we had to ask for it. We said we need something to clean her gums. So okay, so they gave us this little sponge on the stick, and we put that in a special solution that they gave us, which cleaned her gum. And every night, my sister took her dentures home so that, first of all, we didn't want to lose them, right? And so she took them home every day to soak them in the solution. And
Good.
every morning, on my morning, we clean her mouth again, okay? And so thank you so much for that article. So that really helped a great deal. And then as a result, we ended up having a dentist to visit her.
Good. And thank you for pointing out that people who don't have teeth also need to have their gums cleaned. So thank you for emphasizing. That's a very good point as well. Anybody else want to share? This is an article that is not used yet, but it has potential to be used to identify early stage cancer with accuracy, although the accuracy is not at the 90% level yet, but it's tends to get there. It's at the 50 to 70% level. And it is hopeful that get to the point where they can detect 93% of early cancers in men and 84% in women. That's the hope. That has not yet been achieved, but it is the hope that with time, a blood test will be able to detect, based upon the DNA finding in the blood test, earlier cancers that can be treated early and perhaps cured. So it seems likely that with time, we'll be able to diagnose cancer earlier with just a blood test. This is not yet available, but it is something that's down the road.
Dr. Callender, did they say what about the blood would indicate that there was a cancer?
It's a DNA. It's a DNA test, actually. They test your genes and they look at for certain DNA proteins that say they have 115 proteins that seem to be associated with cancer.
Okay.
Let's go to the next one then. This is an article that talks about how 10 minutes of activity takes care of the problem that is so prevalent today, that is anxiety, and that exercise, just 10 minutes a day, physical activity, will help you with being so anxious and fearful about what's going on. And this is an interesting study that, and you can see the large number of women that they did it in. One of the things that I'm wary of in many of these studies is that they don't always tell you about the percentage of people of color they have in the study. And always look for that. But in this study, it's hard to identify whether they have people of color or not. But anyway, the point is that exercise also helps you with anxiety, which of course is one of the commonest mental health issues that we have today.
Dr. Callender, that article was done in Ireland.
Done where?
It was done in Ireland.
Yeah, which makes you wonder again about the percentage of people of color in studies. And when people don't include that in their data, I'm very suspicious about the results. And it's something we should always look for. Are we part of the study? Does it apply to us?
Yeah, only 1.5% of population of Ireland is black.
Yeah, so it answers the question. Yeah. Now, this is a study, you remember we talked last week about a study that didn't have blacks in it, and they talked about stroke. And this points out that we have more strokes than that article pointed out we have more strokes than white people. We also talked about the types of strokes and the intracranial hemorrhage or subarachnoid hemorrhages that are associated with high blood pressure are the ones that are the most fearful and the ones that are more difficult to be treated. And they're often associated with high blood pressure. And of course, diabetes.
Dr. Callender, my question is that these studies that don't include certain ethnic groups and so forth does not mean we can ignore the data. It means we still have to take.
No, it doesn't mean you ignore the data. It just means that the studies have not included us. So that it probably means that it's more relevant to white people than it is to people of color. That's all. I wouldn't ignore it. I'd just take it with a grain of salt. You just haven't included our people, and so I wouldn't ignore it. I just take it with a grain of salt and understand that we were not part of the people that were studied, and that's something that we need to be aware of whenever we read any of these studies.
And
they may apply to us, but they may not.
Right. Yeah, we have to take it into account and
right.
govern ourselves accordingly.
Yes, yes, yes. And of course, to me, when we talk about strokes, in the bottom of many of the strokes is hypertension and diabetes. So optimally managing your diabetes and your high blood pressure as a way of preventing strokes. And we are disproportionately afflicted and affected with hypertension, diabetes, and strokes.
Dr. Callender?
Yes.
That's why I try to participate in different trials and tests and groups studying medicine, studied medical things because we're not represented.
We're indebted to you for doing what you do because that is so important. Any other comments about the fact that strokes are something that take us away often, particularly people of color? Yeah. Although people of all ethnic groups have strokes. Just reading about a 46-year-old guy who was a basketball coach who had a heart attack and died. So it happens to all people, but we just have it happen more often to us. As we talk about AI and genetic tests, and we talk about the wonders of genetic tests, one of the things that it will be helpful down the road as we do more studies is the ability to diagnose early inflammatory arthritis by genetic tests and probes. And this is such a test that looms large in the future, to be able to make an early diagnosis of arthritis so that you can treat it. That's the reason to make an early diagnosis, because there are medications that we can use that will help treat the arthritis once you make the diagnosis. And so as time goes by, more genetic probing tests and artificial intelligence maneuvers will be useful in helping us make earlier diagnosis and treatment of inflammatory problems like arthritis.
Dr. Callender, I hear about it all the time. I feel it when I move sometimes, especially early in the morning, going upstairs, downstairs. Um, what is actually arthritis? What, you know?
Well, arthritis is inflammation of the joints. Now, the arthritis that these people are talking about is actually more like the arthritis that's associated with lupus and gout and those kind of things, in contradistinction to the degenerative arthritis that you may be talking about. Because as you age, and the more active you are as a youngster, the more likely you are to, as you get older, to have degenerative or traumatic arthritis. But this article is talking about the inflammatory arthritis, which is not necessarily associated with the traumatic arthritis that afflicts most of us who age, as we age. That's called degenerative arthritis. But anyway, arthritis is inflammation of the joints. And the more activity you've had as a youngster, the more athletic you are, the more likely you are to have degenerative arthritis, in contradistinction to the inflammatory arthritis, which have nothing to do with the trauma. They have to do with inflammation. Any other comments or questions about, and rheumatology is a field that we talk about, because that's the field in which people really are arthritis experts. And that's a field that many people are going into, and a field in which genetic testing becomes very important. Let's go to the next one if there's no comment. Now, shingles is herpes zoster infection that occurs in the very young and also in the very old, because as you age, the protection that you get from the against the herpes zoster virus decreases, and therefore you need to get after 65. You're advised to get a herpes shingles virus vaccine, which we now have learned that it will last for 4 years. It is can be a very crippling disease in which you have itching and scratching, and you have a nerve involvement that can be very painful. And so you can see that it's a risk of 50% among those aged 85 years of age. So that, and this post-herpetic neuralgia is something that you'd want to avoid. And so the shingles vaccine is something that people over age 65 would do well to take.
I'm up to date on my shingles vaccine, but I didn't know that I need to do it every 4 years.
Yeah, that's what the latest tests are identifying. Next one. Now we've had a plethora of articles telling us about the risk factors for young onset dementia. And you're talking about dementia under 60. And I think most of the risk factors are the same that we always talk about. And much of it, the factors that are sometimes not as often go back up, that aren't as much talked about are the vitamin D deficiency and elevated C-reactive protein, as well as the APOE genetic association. Some of the others are factors are present as well, but I think many people aren't aware of the vitamin D deficiency association. And the C-reactive protein is something that is a measure of inflammation. And I guess because of the pandemic, we are very much aware of the social isolation that is associated with younger age dementia. And this is a interesting study where they followed patients for more than 8 years, and they looked at the 15 risk factors, and they identified a risk factor that's more than 1.0 is high. So if you have 1.6 and 2.0 and threes, those are extraordinarily high. And then this 2-lipoprotein E alleles are pretty high as well. And we talked about that last week. And then of course, the hearing impairment we talked about 1.56, which is pretty high as well. Interesting fact about this was that some of the studies are showing that alcohol may be protective. Yeah. So, any comments about this? As many of us are far beyond the age group of the young dementia.
What is the actual age of young? What do they consider
Under
young?
60, they talk about under 65.
Under 65. Okay.
Yeah. And we see a lot of people in the late 40s and early 50s who demonstrate signs of dementia.
I've heard it called early onset, right?
Yeah, same thing.
Oh, okay.
Yeah, just another term for it. Yeah. I don't think many of us qualify. We're too old. That's a question about COVID and how long does it take? That's a good question. It's something that we really didn't have a good answer for. Many people felt that it was about 5 days, but you can see that in some countries it was about 3 days, even less. So now we think more like 3 to 5 days from the time you expose to the time you start having symptoms.
Dr. Callender, wouldn't that vary if you are vaccinated or not?
I'm not sure because this study didn't differentiate, and I think you'd have to. That's one of the variants that you would need to have to answer that question as to what percentage of people were vaccinated and what percent of people weren't vaccinated. And this did not identify that for me. And that's one of the first questions that you should ask, and you asked it appropriately, is does it make a difference? I don't know the answer to that question. I must add that as I go to different groups, and even in churches now, seems like about 50% of the people in church are now wearing masks. Um, any has
Dr.
that changed in any of the churches you go to?
Dr. Callender, I never stopped wearing a mask.
What's that?
I never stop. Even though I'm surrounded by people with no mask, but I never stop.
What about in your churches? Are they have they started again?
No,
My
they
church,
have not. They have not.
my church, at least 50% of people wear masks.
I looked around the other Sunday and I noticed that a lot of people, I looked very close, I noticed that a lot of people had on black masks.
Yeah,
So,
yeah,
of course, I got a supply of white masks, but
yeah.
I noticed that I had to look real, as I began to examine a little closer, I noticed that they had on black masks, which is not as obvious to see.
Okay, well,
Dr. Callender, the churches that I play for and et cetera, I'll say that 98% do not have masks on. And they stop
really?
wiping the microphones down. They used to be so, one church particular, they take a Kleenex to wipe the mics down after someone would talk. And I was going to volunteer to buy one of those mic masks, but I didn't. But the head deacon would take a Kleenex to wipe each mic after somebody spoke. But majority of the congregations that I'm at 2 or 3 churches, nobody hardly has a mask on.
Hmm.
Whether
guess
it's Presbyterian or Baptist.
Well, I guess my church is older, but they at least 50%.
No,
Maybe
they have you, and they have some intelligent people. Not saying that the churches I go to are not intelligent.
yeah.
But they are.
My church also still enforce the mask rules.
Hmm. So it varies a lot.
I've noticed at the grocery store, I'm seeing more masks now,
Yeah.
but fewer than half, maybe fewer than a third have masks, but there are more there.
Well, I don't go to church, just the dens of iniquity, and the nightclubs, nobody wears masks.
Nobody.
Nobody.
On some of my gigs, I'd say maybe 5%
Really?
are wearing masks, and that's more than over the summer. Over the summer, you hardly had any. So there are a few more coming up.
Now this is not so good news. Actually, have people who steal the fentanyl from the IV and replace it with tap water, leading to infections in patients. So, of course, people who died from the infection. Of course, people who take the fentanyl have died as well. But it's a sad situation when people are stealing the fentanyl from the IVs and giving it and giving patients tap water, which can be fatal. So man's inhumanity to man continues to amaze.
And
But
then
this is just,
they take the fentanyl and then they die of overdose of fentanyl.
yeah, 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 yeah. Double whammy. Yeah. They kill the patients with the tap water because it's not clean and given it in the IV. And then they take and give it to people out in the street who overdose. Yeah. Sad story.
Dr. Callender, who's stealing it? Is it the people that work at the hospital?
Yes. There's a nurse. There's a nurse here. She was stealing 17 bags of fentanyl.
Yeah, she looks like a thief.
Oh, please. What does a thief look like, John? Please.
They breathing.
Everybody looks like a thief when you take their mugshot.
You're right. Yeah. Well, if they would replace it with sterile saline, it would be okay, but replacing with tap water is dangerous.
I mean, even if they replace it with sterile saline, they're getting fentanyl because they have a lot of pain. So they would have a lot of pain. They may not die, but they will be in pain, right?
Yeah, it's a dangerous practice because fentanyl is not only used for pain, but used to put people to sleep for operations. And so that's very bad practice. It's amazing how they found some of these patients, you see. Sad. I thought I included this because sometimes we think that it's only white people who have their own hit list. But here's a diversity person who has a hit list that included white people, heterosexuals, Christians, and men. And this is a person who's heading the chief diversity office, and who happens to be a black person, as you can see. Uh, and why somebody would email that, I don't know. Well, although there may be some validity to those who are privileged, but
Hello. Good morning, Dr. Harris.
hello, how are you? Welcome.
Yeah, we have a guest today, Reverend Dr. Barbara Duncan.
Okay. Well,
Yeah, she should probably be on mute.
Okay, we'll take care of that.
okay, well, she probably didn't mean any harm, but harm was taken. So it's going to be interesting to see what happens. uh, well, it's sometimes things that are done without intent can cause a lot of harm. She didn't mean to be harmful, but it turned out to be harmful. And when you're a person of color, they're looking for something anyway, so they found it. Let's go to the next one, unless you have any comment about it. This is one of the subjects that is concerning everybody. What about the plastics that we use? We use plastic for everything. Is plastic getting into our bloodstreams? As we microwave and do other things with plastic, is that killing us? Should we go back to tap water? These are some of the questions that are brought up because We use so much plastic. Just about all the distilled water that you buy is in plastics. Many of the containers are in plastics. And plastic is everywhere. It's in the ocean. Is that bad for us? We're talking about processed foods. This is even worse. This is plastics in water. And almost everything we deal with. Microplastics, nanoplastics. Is this good, bad, or indifferent? This is what these articles are about. What is the conclusion?
I think we talked about this before.
We
and,
did.
Yeah, and I think that we were talking about, the minimal amounts of plastic in the bloodstream where it was not harmful, but it's that when you have an excess of plastic, I guess it would be bad.
No, well, actually, this article is saying just the opposite, that any of it, whether it's the large amounts or the nano amounts, they're bad for you. And that were they to measure this in the bloodstream, it would be interesting. But they're proposing that that these plastics and other phthalates, for example, that they use to make plastics more flexible, that these cause morbidity as well. And they are suggesting anytime you microwave something that's in plastic, that it gets into the food. And that this is harmful. And I think there's a second article which will come after this one that goes into the specifics about how much, what kinds of diseases are related to the nanoplastics and the microplastics. See where it says there, the nanoplastics are believed to be more toxic because they are smaller, and therefore they get into the bloodstream. It's frightening, and the next article actually is even more frightening because they talk about the disease burden, and they say it amounts to almost 250 billion in 2018 alone. And they talk about the diseases which are associated with the plastic exposure. Diabetes, obesity. So much so that they have actually talked about recommending to drink tap water rather than distilled water because the distilled water is in a plastic container. So what do you do? What are your thoughts about this article? Is this frightening?
What can you do? Plastic is everywhere.
You're right.
They want to ban the plastic bags, but as someone else, what about the everything else that's in plastic?
Right.
I don't know.
Yeah.
All of our meat products are in plastic. The thing about it is, I don't understand what Maryland is doing. They had plastic. I used to ask for paper bags, and then they didn't have it. All they had was plastic, except for Whole Foods that cost you an arm and a leg. Now they are charging you a dime for these paper bags, which are better. At first, like Shoppers, they had these plastic biodegradable bags, Then all of a sudden they got rid of that and gave us the cheap paper bags that'll last for 2 seconds. But where is the money going? Does anybody know who are the stores racking up by charging us 10 cents a bag, or where is this money actually going? And how can they keep track on how many bags that everybody is using?
I have no answers to any of those questions. One thing is clear is that the disease burden of plastics is increasing every year.
John, why don't you Google that question? You Google everything else. John Tatum, where does the money go for the plastic bags in Maryland and in other states?
You're mixing
I'm
me up
sure
with
it's there.
Darryl Armistead.
I'm sure it's there.
Yeah, you're mixing me up with Darryl Armistead. I'm not Google fact John.
Well, Siri, John, you're Siri or Google, one or the other. Every time I ask you
No,
something,
I've moved on to AI.
Oh, excuse me. Ask AI then.
I'll say anyway.
Dr. Callender, what does disease burden mean?
It means that these plastics are causing you to be sick. And they're talking about the link to preterm birth, reduced sperm count, childhood obesity. And as you go down, they talk about actually other chronic diseases that they think are related to plastics, childhood obesity and kidney failure and gestational diabetes, which is the diabetes associated with pregnancy. So you can see that we are just beginning to understand the disease burden of plastics. So as we know more of the answer to these questions, I think we may be even more frightened.
Okay, I'm gonna stop the share because I gotta reset the screen. Okay, hold on.
You know, we talk about the processed foods. Now we're talking about the water in plastic bags, and plastics taking over everything, and you find it everywhere in the ocean, in the water. So what are you going to do to stay healthy? Question.
Okay, let's give this a shot. Folks, these are announcements for the next month's showcase with Dr. Callender and 5 other very important African Americans for our Black History Month. The first 2 are just links, but the last one is a video. And we're going to try to play that. Let's see what happens here.
Join us at Asbury UMC DC as we celebrate Black History Month with a special 2-part event. On Sundays, February 11th.
Okay, I'm going to stop it.
We honor 3 of 6.
I'm going to try something else.
And after that, you might try the video on
Remarkable trailblazers. Join us as we honor them during.
Okay, I think you can see that, right?
Yeah.
Okay, but could you hear it?
No.
At Asbury UMC DC.
Yep.
Black History Month with a special 2-part event. On Sundays, February 11th and 18th. we honor 3 of 6 remarkable trailblazers. Join us as we honor them during our 10 a.m. worship service. At noon, experience their inspiring stories and seek insights during our captivating panel discussion, Voices of Influence, celebrating Black achievement. On Sunday, February 11th, meet Dr. Clive Callender, Brigadier General retired Audrey Drake, and Mr. Cardell Richardson Sr. On Sunday, February 18th, meet Ms. Carol Thompson Cole, U.S. District Judge retired Henry Kennedy Jr., and Mr. Charles Ross. Don't miss this opportunity to celebrate the legacy and continued impact of these extraordinary individuals at Asbury UMC. Together, we keep the spirit of achievement and community alive. Look forward to seeing you there.
All right, that's
Yeah.
phase one.
You wanna try the robotic thing now?
Yeah, Will.
This is an article you've all heard about robotic surgery being the newest type of surgery that is associated with a small incision. But very often it's talked about in medical meetings, but the patient perspective of it isn't often talked about. And this is a Black surgeon who talks about the benefits of robotic surgery as it relates to patients. So I thought if we could show it, it would be good. The bottom line is that the purpose of, let's see if we can.
My name is James Ray Daniels Jr. I'm one of the new surgeons at Centarius Surgery Specialists, working with Dr. Darryl Times and Dr. Robert Swords in Williamsburg. One of the advantages to robotic surgery, just like laparoscopy, is that patients have precisions, which means less pain, better prosthesis, quicker recovery so they can return to work and the other activities that they enjoy. Specifically with robotic surgery and doing some of the more complex procedures as colon resections, I think patients have a shorter stay in the hospital, quicker return to bowel function, and just an overall recovery and experience as well with doing their procedures. As a surgeon, I think robotic surgery does provide some advantages over traditional laparoscopy. I think that you have much more control over the procedure. In doing laparoscopy, you have assistants that are handling the camera and other instruments, which you have more control over whenever you're sitting at the console as a robotic surgeon. I think visualization is much better. I think ergonomically, you're able to do some of the procedures, specifically sewing on bowel anastomosis that you aren't allowed to do with the laparoscopic approach. I think that there's less tension and stress on your arms and forearms in doing certain procedures over a lengthy period of time as well.
Okay. Any comments or questions about robotic surgery? That's something that's here to stay. We started off with prostatic surgery. Now it's expanded to just about virtually all surgical procedures. One of the things that he didn't mention is that as the surgeons age, the tremor increases, and so with the robotic surgery, there's no worry about that because the machine actually does the surgery. The surgeon directs it, but it's the machine that does it. And so it's sometimes it may be a little longer, but it's associated with a smaller incision and associated with less complications. Any of you had any robotic surgery procedures?
Yes, I did.
Any comments about it? No comment?
You muted yourself, Mariana.
We can't hear you.
You muted yourself.
Oh, okay. I had robotic surgery, laparoscopy.
No, laparoscopic and robotic are two different things.
Oh, okay. How about, I think I might have had it. I know I had it on one of my bills. Maybe could it have been for my thyroidectomy? Because I had a bill, I had a real large bill of surgery. I haven't had many surgeries. I've only had about 3. And one of them had robotic in the, in the tallying.
So you didn't
I
notice
thought
any
it was-
difference?
I thought it was the laparoscopy.
Laparoscopic is an advance, but robotic goes a step beyond.
Oh, okay.
Because laparoscopic, the surgeon actually does the surgery. With robotics, the machine actually does the operation.
Yeah, robots charge a little bit more.
Yeah.
Yeah. Okay, but that's the future. Laparoscopic. Yes, Joyce?
My husband had robotic surgery on his knees. And the funny part about it, when the doctor came out to let me know that the surgery had been successfully completed, he looked so calm. And normally when your surgeons would come out, they'd be kind of sweaty and, kind of tired, but he looked very calm. So the advantage for the surgeons was that they did not get as interactive with the surgery as a regular surgery. And the benefit for my husband was that the cutting and the incisions that were made were not as large because they made like pinholes and they went through the pinholes to do what they had to do. His recovery time was much quicker and his downtime was less also. So it was really beneficial for him.
That's pretty much what the surgeon said too, isn't it? Yeah, right. Okay, any other comments about this new advance that I wanted you to be aware of? It was first utilized for prostatic surgery, which is very common in older men. And now it's been used for just about virtually every surgical procedure.
Yeah,
Okay.
Dr. Pratt, there's a mixture of robotic surgery machines and what they call the instructions. I forgot the name of what they call the instructions for the robots, but AI plays a role in that.
Any other comments about this? Is that the last article, John?
Yes.
Okay. All right. Well, any other comments? If not, thank you for participating. It's been an interesting session. I guess, does the plastic discussion frighten many of you?
Yes.
I just
Yeah.
added to the list of things that are frightening.
I'm going to be drinking a lot more tap water because I don't have lead pipes. My pipes were put in 2003, so that was past the when they were installing lead pipes. So I'm using a water cooler with the hard plastic bottles, which are safer than the single-use bottles. You know, that's what you get, 12 and 16 ounces for a bottle of water. I try to avoid those just because, you know, they say the presence of nano and microplastics is much more in the soft plastics, but I'm not so sure about the hard plastic 5-gallon bottles either. So it's tap water for me. But Carol and John, when you come to visit, you can have your choice: water cooler or tap water.
That's the same thing here. I rely more on my bottles than the plastic bottles. We very seldom use them here, and we basically use tap water and have filtered water in the refrigerator that we use.
Yeah, when I travel, I'm like Joyce. I got a travel bottle of stainless steel, and I fill it with tap water.
Wines.
What was the propaganda that they put out about tap water? Because everybody, it seemed like they're petrified to get water out of the sink. If you come to your home and you say, "I'll give you a glass of water," if you go near the sink, they look like in terror. So what was this propaganda that they gave to Americans?
It wasn't propaganda.
Wasn't propaganda. If
It's
Grand
not
Rapids, Michigan, Jackson, Mississippi, some of that water there could kill you.
Yeah.
Yeah.
So is that all water or just in
No,
those
not
areas?
all. Some water's safe, some's not.
Detroit.
You
I
know, because
remember when I was at Spingarn, I think I talked about this before. We did a taste test with 5 different sources of water. We had tap water, we had distilled water, we had sparkling water, we had 4 different brands of bottled water. And you know, the kids didn't know, you know, what brand it was. And a vast majority, I'm telling you, a vast majority of them chose the tap water. Unbelievable.
I used to like water out of a hose. I like the way it tastes.
Well, look at that background for John Buchanan. It's a mountain scene, and real mountain spring water tastes wonderful.
Yeah.
I remember going back and forth in South Carolina. They had well water. That was the best tasting water to me.
It didn't smell too good though. It smelled like rotten eggs.
Well, we didn't have that.
Reverend Duncan, do you want to say something to Dr. Callender? You're on mute. This is our guest today, Dr. Callender. Yeah,
Welcome.
She's at the doctor's office, so I won't bother her.
Okay. Well, let him know we're glad to have him today, and he's welcome to come back any Thursday, 9 to 10.
Mhm.
Yeah. Well, thank you all for attending, and